Hello and welcome to the Bee Formless Flow Driven CEO podcast. I'm going to say Dr. Julia Rosenthal, all the way from one of my favorite places in the world, which is New York City. Around 6:40 on a Monday evening. And welcome to the show, Julia.
Thank you so much. Thanks so much for having me. I'm excited.
Yeah, I'm excited as well. We had a good old little quick chit chat. It always happens before I hit record that we end up talking, and then I'm like, oh gosh, we've got to get into it because we've got a lot to. I think we're going to have a really good chat and conversation. Yeah, so all the way from New York City, doctor in physical therapy, trauma-informed practitioner. You're the founder of Empower PT. Love that. I love the name of your business. I probably will ask you for my brand days how you got to that name, but just the word empower, it makes me feel really empowered. In New York City, and your integrative body-based practice helps clients and supports clients to move through both physical but emotional pain by creating safe spaces for healing. And your approach, from what I understand, blends functional medicine, somatic awareness, and radical compassion to empower individuals to reclaim their vitality. So at Empower PT, it sounds like you're not just treating the symptoms, you're absolutely reshaping what it means to live, and lead and live from this place of wholeness. Tell us about your journey, how you got to start your own company, how you came into this field. I'd love to hear all the backstory.
Yeah. So, how I got into this field and how I got into starting this company are sort of like two different things. But how I got into this field was that when I was in undergraduate school, I thought I wanted to be a medical doctor. I was doing all of my pre-med prerequisites and all of those things, but I was also studying medical anthropology and doing a lot of reading on, how pharmaceutical companies work in the United States and starting to really understand to the best of my ability the day-to-day experience of a medical doctor and realizing that that was actually not what I wanted for myself or even how I wanted to really be engaging with people in the long term. So I ended up just started like shadowing all kinds of different practitioners. I shadowed acupuncturists and chiropractors and physio. I actually shadowed because my sister had recently been in a car accident and she's fine now.
Okay.
But she was doing a bunch of PT at the time. So I had access to that through her. So I was just sort of trying to get my feet wet in as many ways as possible. And I found physical therapy to be something that made sense to me from like a how it works standpoint, but also really something that would give me a little bit more ability to be present with my future patients in a way that being a medical doctor might not really give me. And that was the beginning. So then went to I pivoted. I went to graduate school for physical therapy. And while in school, I thought, great, I'm an active person. I'm a big lifter. I'm going to work with lifting athletes. This is going to be great. Meanwhile, I was having all kinds of issues that were related to my lifting that I thought were because of my hips and because of whatever else, my rib cage, my shoulder mobility, all kinds of things. And I found out because my sister's friend was in PT for constipation that there was such a thing as pelvic floor physical therapy. And I was like, I need to know everything about what that is. I need to know that
Yeah,
right
100%.
now. Yes, because I was struggling with that. I had some issues with like my abdominal wall. I was having all kinds of
Oh,
stuff that wasn't really getting any better with any kind of traditional
yeah.
solutions. And meanwhile, here I was in physical therapy school, not even knowing that this existed. So I decided I needed to know everything about that. And once I sort of learned that, so basically, pelvic floor physical therapists, for those who don't know, work with people with any kind of bowel, bladder, or sexual dysfunction from a neuromusculoskeletal
Yeah, right.
standpoint. We're addressing like the non-medical, non-cardiovascular, et cetera, reasons why these things might be there in the body.
Yeah, okay.
Um, so that was my road to pelvic PT. And the longer I did it, the more I realized, being really good at hands-on skills is great. Being really good at teaching people how to move is maybe even more important. But unless you can really understand multi-systems and how things are interacting, you won't really hit it
Yeah.
with this group of things. You have to understand how people's nervous systems are involved, how people's genital urinary and bowel function and cardiovascular health and endocrine health, being this is very highly, there are a lot of female clients in this population, hormonal health, menstrual health, all of
Yeah.
these things that are like really impacting a person's well-being. So it was very alluring to me from that standpoint as well, because the more I was exposed to, the more I realized like, oh my goodness, I need to go know that thing
But you were lived
also.
experience, right? Like I always think about like from a lived experience, if you've lived the experience and you're exploring it for yourself, like it's
Hmm.
only going to put you in the most amazing stead if you end up specializing or, your career, your focus in your
Yeah,
business is around that because you've lived it. So you can actually totally empathize, you can relate with your
totally.
clients versus sometimes you might go see somebody for something and they're looking at you and you're like, you just don't understand what's going on here. Like I'm losing my mind because of this. Do you know what I
Yeah.
mean? Like,
And
yeah,
I think that's why too, this is something I say to my clients all the time is like, well, this may not make sense, or you may not believe that this is how it is. And I'm like, no, the only person in your body is you. The only
yeah,
person who can tell me what this feels like for you is you. So of
yeah,
course I'm going to believe that. But people, I think, feel very not believed in a lot of medical settings. So I think that's where some of that comes from. But
yeah. And it sounds like a deep-seated curiosity as well, like just the exploration of, well, I want to understand everything. And, it takes me to like this wholeness, this whole body piece, right? And everything's connected or interconnected as such, like like the physical and the emotional. You know what's really interesting? Like you guys call it in the US physical therapy. We call it physiotherapy here. So it's
yeah.
so funny how
Yeah.
there's like that. Just a slight difference in the name, but it's like so because physical I get, and then physio it's like oh okay yeah. So
Right.
then you finish studying, you're doing all this
Yes.
exploration. So then what happens next? Like what led you then down, where
Um,
was your next trajectory? Hmm.
Yes. So I was working in a pelvic floor, like a private sort of boutique pelvic floor physical therapy clinic in Manhattan. And then COVID hit. And that was a time when a lot of private practices really struggled, including the one where I was working. And unfortunately, they had to let pretty much everyone go. They kept one therapist there were, I think, 8 of us in that location, and they kept one just to like cover as much as that one person could cover, because that was what we didn't know. Nobody had any answers at that time, and I was already starting to feel I always wanted to go into academia, as you've already kind of indicated. Like I really enjoy learning stuff. I'm always curious about everything. I sometimes joke that if there was a career path that was just permanently in school, I might have chosen it. But I was sort of feeling out how I was maybe going to make my pivot towards academia. I was not really sure where I was going. And then when COVID ultimately hit and I lost my job, I had this moment of, okay, either I'm going to do something completely else, like I'm going to leave this part of my career behind me, or this is probably going to be the moment where I have to pivot if I'm going to pivot.
Yeah, love it.
Um, Long story short, I ended up taking a teaching job at the place where I had done my program because they needed help making sure everybody who had taken all this time off was going to be able to graduate on time. And that gave me the stable base that I needed to ultimately launch my business, which I did in the beginning as a telehealth only service because
You
COVID.
couldn't catch up with people physically, yeah, in person. Yeah.
Right. So that was the beginning. And and at that time, I think it felt very low pressure because I saw it as this kind of bridge to whatever was going to happen next. I had taken the academic job. So I was like, okay, this is just going to help me make money until I can take whatever the next steps are with that. But COVID was a highly unpredictable time, and those next steps really were not showing up at a rate that was working for me. And the more time went on, the more people were comfortable being seen in person, and things were changing. And so more and more of my clients started asking me, like, would you come to my house? Like, have you considered renting a space and seeing some clients out of there? People wanted to be seen, so I just started seeing them. So it
How
became like
cool.
health and home health, and then I was renting a room out of a gym in Manhattan. And then I sort of got to the point where I realized that this side hustle was no longer a side hustle. It had kind of become my full-time job, which was the point where I said to myself, well, if I'm gonna do it, if I'm really gonna have a physical location, I might as well do it in Brooklyn because that's where I live. So I started looking for space, and now I have a physical location here, which I'm hoping to expand into a larger location in the next few months. And I have another therapist who works for me, and I'm hiring another one. So
How
it's just
exciting.
taking off.
Yeah.
Yeah.
So amazing. Quite often we get attached or fixed to an outcome, don't we? And then we want it to happen quickly or we want it to happen a certain way. And yet, I don't know, the universe or whoever has a different
Plans.
right for
Yeah.
us. So you kind of like, okay, I just have to trust the process somewhat as much as you're like, oh my God, like, it's like school in a way when you talk about, like you do this and you go to this and you do this. But in in business, it's so very different, isn't it? In terms of like, and then you
Absolutely.
have clients or people or your tribe, if you like, saying to you, why don't you try this? Or why don't you do this? So they're almost guiding you in a way as well. So tell us about your clients, like exactly like, I mean, obviously not sharing personal information as such, but like, the physical and emotional pain and how you create the safe spaces and the sorts of functional medicine and somatic awareness and radical compassion. Like, talk us a bit about that. I'm kind of keen to understand. Yeah.
Yeah. So to be clear, I'm not a functional medicine practitioner. Have some experience with functional medicine, especially from like a supplementation and
Yeah.
nutrition
Yep.
standpoint from some of the education that I've done. But if somebody needs something genuinely involved in that space, I have other people who I refer to
Yep.
for that. But I would say it starts with listening. I think people in healthcare spaces oftentimes really don't get to just tell their story from beginning to end. And so there's a long intake form that people fill out, and they're like, oh my God, this took me 15 minutes. And I'm like, well, get ready because you're probably going to sit here and talk for the next 30.
Yeah.
I
I love
just
that.
want Right. I just want people to have a chance to really tell their story in their words. And from a provider standpoint, there's all kinds of context clues in that. You can really learn so much without ever doing a physical exam, just listening to what people have
Going
to
on.
say. And so I think that in and of itself is immensely healing. I've had some clients who I'm like trying to encourage to see a mental health counselor, but maybe they're not really there yet. And there have been times where I just sort of tell myself, like, okay, if I can create an environment safe enough to get this person to really cry in this session, they'll probably feel better when they leave, you
Yeah.
know? So there is this sort of element of like how much of what is this person is experiencing in their body is really coming from whatever musculoskeletal structures are involved versus how their body is responding to the context and the environment and the relationships and the other things that are going on.
And do you get people that come in that, excuse me, that they almost come in for a physical, they've got a physical condition, right? And you get them to fill out this form, which is for me like it's part of my methodology and what I do in terms of just like you ask all these questions in a learn phase, you're learning about them, they're learning about themselves. Be
Mhm.
like, this isn't working for you. We have to look at this and we have to reshape, or we have to, like, you're disconnected and it's almost like they're coming in for something very physical, and yet you're pulling out the emotional as well, and then they go, oh, I hadn't thought about that, or I'd been resisting that, or like, do you, like, is that what does that happen? Do you get clients that come in like
Yeah.
that and they're
Most of the
like,
time, people come with some kind of physical ailment. They're not here because they have realized, like, oh, there's like a very clear link between
trauma?
whatever emotional stress happened and when this started. But that's why, it almost doesn't, if I hear them tell me that in the course of the story, me pointing it out to them is not enough. They
No,
need to sort of
work.
realize it on their own. So it's never, the conversation never goes like, did you hear yourself just say that, like, when
Yeah,
your mom died, this started happening? Like they're not going to respond well to that. It's too abrasive. So you have to, it's more of just kind of like leaning into and then they'll say, X many number of years ago, I started to feel this. And the question is like, okay, well, what was going on around that time? What were you doing? Or like, what was happening in your life so that they can sort of start to
put it together.
put
Yeah.
that timeline together on their own. Um, and that's so much more empowering than me pointing it out to them for
Yeah, it's
them.
100%. It's that radical compassion, but you're creating the safe space and the awareness I guess, a safe space, aren't you, for the awareness to come up for them, because it's not going to be in the first session, but they almost have a light bulb moment, and sometimes it can take weeks, sometimes it can take quite a while, and then they go, oh, and they see it
Yeah.
all, and then they're like, okay, I get it
Yeah.
now. Like, and I always find
Totally.
that, like, I mean, obviously super different to what we each do, but you can't underestimate like the emotional trauma like you're talking about.
Yeah.
Um,
There is a physical, I mean, it's not all talking.
no,
There
no, no,
is
I
like
get
a
it. Yeah.
genuine physical therapy piece. And what I tell people all the time too is like, just because we're having this conversation about what your nervous system is doing and how like the context and the environment and all these things are playing into it does not mean that there is now like a genuine musculoskeletal thing happening. There is that happening, and we will address that at the same time. But if we don't kind of look at all of it as interconnected, then we haven't really addressed it enough to where you're going to have enough of a long-term benefit.
Yeah. It's so interesting you talk about this. I've always had my physio or physical therapist. Like, I broke my ankle back in 2017, and actually last year broke my finger. My puppy accidentally pulled the lead. And it's always whatever my emotions or my traumas always come out in the physical, right? And then I end up at the physio or whatever, and the ankle was actually, I physically broke it,
Yeah.
but it was my first mini burnout, and yeah, so there I have the surgery, and then I'm off to see my physical therapist or physio, and I'm just like wanting to be back to just that male energy, just fix it, I'm going forward, and this physio is just looking at me as if to say, we've got a bit of work to do here. Like, and I look back now and I reflect, and I'm like, oh my God, he was like my full counselor. Like, he took me from physical into the mental space to the emotional. I ended up seeing him on and off for years. And it was always when I was in some sort of trauma or stuck or blocked.
Hmm.
And we'd
Your
have this.
body is going to tell you
Yeah,
something
and he had this
there.
unique
Yeah.
ability, and it sounds like what you're doing. Like, I mean, in terms of just this unique ability to like be able to not just come in and lecture me and tell me, but he'd just ask the questions, and I'd be like, sometimes I'd end up in tears, and I'd be just like he was like, it was like seeing as, sometimes a psychologist or whatever. And even last
It's
year with my
kind of
thing,
unique. It's a privileged position to be in, especially when I mean, it sounds like you really got to spend a lot of time with this person and, being the person that it's like why people talk to the
I
hairdressers
know,
and all kinds of, right? It's like you're just there in a way that feels neutral and in a way that feels like safe enough and sort of outside enough of a person's life that they feel safe to start to tell you things. And then when you add in the piece where you're also
I lost you.
physical body. You only get one of those, you know?
Yeah.
It's your ability to move around the world, your ability to participate in your life in the ways that are important to you. And that can really bring out a lot of things.
Yeah. And do you have all walks of life in terms of pe clients that come through to you? Like, do you have like do you see a bit of a pattern? Like, do you see like, is it high performers? Is it stressed out people? Is it like, or is it kind of all different types that you tend to get?
It depends. I mean, this is New York City, so there's a lot of high stress, high performing people here. There was actually an article that recently came out in Bloomberg talking about how working in finance is like wreaking havoc on men's pelvic floors, which is
Really?
true. Every person who's a pelvic floor physio who read that was like, duh, you know, and
Yeah.
everybody else was like, this is crazy. And we were like, this makes sense.
Yeah.
Um, but yes, so we see lots of, high performance folks. There's, for whatever reason, there's a lot of lawyers who live in the neighborhood where we are. So we see a lot of people, you know, working in consulting, working in law, financial business, that kind of thing. But we do also see, other people. We see people who are like of college student age or people who are working in more creative fields. Um, it really varies. And we also see people of all genders, and like the age range of our clients vary pretty significantly. I would say the youngest are probably in their late teens, early 20s, and the oldest are right now probably in their early 70s.
Yeah, right.
Um,
Yeah,
so
it's
big
fast.
range.
Yeah, it's fascinating. But it's fascinating you're talking about like the big range, but also the lawyers, the bankers, finances, the creative industry, which is what I've come out of, which is just like, yeah, I burnt out from that, from
Right.
working like the way
It
I did.
sounds like it's going to be more chill, but it isn't.
No,
It's definitely not. Yeah.
totally right. And I keep asking all these questions, but somatic experiences, can you just share a little bit more on, what that is in terms of, I know what it is, but I'm keen just to understand it in a bit more detail. I've lost you again. Hello?
Sorry, you froze for a moment. I was
Yeah,
just,
that's okay. We'll keep going. I can fix it.
yeah,
But yeah, I lost you
ask me
too.
your question. Yeah, ask me your question again.
Did you hear my question? In terms of so somatic experiences, can you tell us a little bit more about what that entails?
Yeah. So again, I'm not a somatic experiencing practitioner.
Yep.
If somebody needs that, I have people who I send that to. But I would say that anything that is an embodied experience can be a way for people to tune into their own somatic experience of their body. Somatic just meaning like kind of tactile, physical
Yeah.
experience of their body. So there are people who work with that in a more like counseling specific setting, but part of the goal of movement is to help people learn how to participate in something that is embodied. And a lot of people will think of that in the context of something like yoga or something that has a more like mindful connotation, but any movement practice can be an embodied practice. And a lot of what we do is we use weights, like we use loads to help people. They basically give people feedback, and people have to learn how to move with them or around them or however, based on what we're having them do. But how your body is going to behave with that type of feedback and is going to be different. And so you can like learn a little bit more about what it feels to do things in a different context, maybe, than you may see or experience in your day-to-day life. And that is a good long-term tool also for people to have. We talk so much about needing to have mindfulness strategies in our lives, but what if being able to like lift something heavy is your mindfulness practice? What a win-win. Two
Yeah,
birds, one.
100%. Yeah, I look at it like from an active recovery. And I think, also for me, that was one of what my physical therapist said to me, like when I was in the depths of burnout and I was just completely like, I had a sore elbow, I think at the time, I can't remember. But he said I was doing too much repetitive, but there was also a lot of emotional stuff going on. And so he actually was very similar to what you're talking about. He was like, I want you to start doing some strength. I want you to change your routine up, strength trainings. And he was helping me with like lifting and doing things. But like, yeah, it completely did change my mindset mentally, but also physically. And it's something that I've stuck with since. Like, I find that I do when I'm doing functional strength. I don't know, it's just it versus like full cardio when you're running 100 miles an hour. Like it was just
Think
exhausting.
about too, like training, any form of training is essentially like dosed stress.
Yeah,
You're choosing to introduce stress to the system, and our
yeah.
bodies don't understand the difference between different types of stress. So anything that falls into the bucket of what is physiological stress can be stress. So that could be stress, mental stress, work stress, relationship stress, those things, but it could also be not sleeping enough, not drinking enough water, not getting enough nutrients, over exerting consistently from a movement standpoint. So, like, for example, we work with a lot of pregnant and postpartum folks, and we'll get people who are like, I just want to go. I don't understand. Like, I used to go to F45 or whatever fitness thing, high intensity interval training class of choice, every single day, 5 days a week, 7 days a week, whatever. And I feel not that great. Like I always have this shoulder thing or whatever thing creeps up. And I'm like, yeah, you're just like burning yourself slowly into the ground. There needs to be enough recovery. The other things need to be there to support a system that is being asked to withstand all of this other stress,
So
you
true.
know?
Yeah, my whole physical exercise regime and active recovery has completely changed in the last 3 years since coming out of burnout. Like, yeah, I used to just thrash myself at the gym. Like I thought that was
Yeah.
working out.
And it's cathartic. It's like what you think your body needs. And
Yeah,
not to say, I'm not sitting here trying to demonize all cardiovascular exercise.
no, God
It's
no.
good.
Yeah.
But there is a certain amount of like, if I'm just burning myself, torching myself, it's called burnout for a reason, right? Like if I'm just kind of burning the candle all the way through the wick, then eventually there will be nothing left. And something else that I say to people all the time is like, if you are not realizing that your body is sort of like starting to reach that point, your body will tell you something's going to happen. That's going to be the moment where you like went to do that one thing that you always do all the time, but that time it didn't feel right, or you got sick, or whatever. Your body.
Yeah, I so relate to that. That's what comes out for me in the physical. That's what happened with me wakeboarding. I was doing my standard jump, wake to wake. Everything was really, and I bang, broke it. Like, just landed in the weirdest shape and way. Like,
Yeah.
when you signed up when you booked into the pod, I shouldn't say signed up, booked in. I've obviously got a question that I ask everybody around, one unique insight. Or around life leadership or business. And you said the things people think are too personal to talk about, like pain, shame, and vulnerability, are often the exact things blocking them from showing up fully in their lives, their work, and their relationships. We've talked a bit about this. I've learned that when you create space for those conversations, healing becomes a leadership skill. Can you
Yeah.
just elaborate a little bit on that last piece? Because I think we have been talking a lot about this, but yeah, it's really fascinating. And when I read it, I was like, yeah, that's really interesting how you've explained that.
Meant that coming from like the place that the clients are coming from is I think when you are in pain or something that is sort of central to your existence is not possible for you, a lot of times that goes on for a very long time before it really ever reaches the point where you get help for it. And then part of what happens is that it becomes the inability to do that thing becomes part of your identity. So now it's like, oh, I have a bad knee, like I can't do that anymore. I don't squat anymore. Or, oh, um, I'm too old to lift weights, like I can't really do that anymore. Or whatever the thing is, you just kind of end up like taking a back seat almost in your own life and just letting those other things rule you. And then it takes a lot of bravery and admitting those things and coming face to face with some of the realities of the ways in which, you know, other things have held you back, but also you have played a role in that by making some of the choices that you've made up until that point and being willing to make changes to some things that are really difficult behavioral changes is hard. But once you do those things, then you get to take charge of your own life again. You are leading, you are the leader of your own experience. And so it can be really empowering
Okay, I was about
to,
to say, there goes that. There's the empowering. Yeah,
yeah.
I love it. I love it so much. That's so much. I've got one last question for you. What would I need to think about that. Generally, they just come to me, but like this one's more, and it is coming to me. But it's what would be your bit of advice for somebody who is struggling or operating from what I call survival mode and unsure how to they're almost like they're stuck, right? And they don't know where what to do next. What like I mean, I know that's a pretty broad question given what that you're in physical therapy, but it
Mhm.
somewhat is to do with physical and well, it's completely to do with physical and emotional therapy. What would be the first bit of advice or tip you would give to them if they know that there's something genuinely not right, but they feel stuck and they don't feel like they have anywhere to turn to in terms of they don't know what to do next.
You mean in their careers or you mean like in their
Life, career, anything in general. What would be your one piece of advice?
I think most of us can't really be objective about our own experience. It's very hard to genuinely reflect in a way that is honest. And so depending on what you're looking for support with changing or feeling like needs to change, whether it's career or healthcare, looking to somebody who can help coach you or guide you towards the right healing path or whatever that road needs to be. But having somebody who can be almost like a neutral third party who can listen and help you navigate that is really powerful.
I love that. Thank you so much. So, Julia, how do we find out more about Empower PT?
Yeah. So you can follow us on Instagram at EmpowerPTNYC. You can learn more about us on our website at www.empowerpt.nyc. And you can follow me on Instagram at Dr. Julia Rosenthal.
Cool. Excellent. Well, thank you so much, Julia. I'm going to let you get back to your summer evening. I love it when like it's
Yeah.
still daylight probably outside, right? Like until
It
about two
is. It's the
o'clock.
best. Oh,
Yeah,
it's so
it's so good.
wonderful.
Enjoying those summer vibes. I was looking at your nails. I've got like the winter sparkle on it.
Oh, yeah, no, I'm
That,
like full
that yellow.
yellow right
I'm like,
now.
I was looking at them before going, oh, I'm going to get yellow in the summer. I can't wait. We've still got a little while to go. But Julie, I'm wishing you all the best with Empower and PT. It sounds like you are only seriously just getting started, and so congratulations. But thank you for sharing all your journey and your wonderful advice and all your insights. It's been a pleasure talking to you.
Likewise. Thank you so much. Thanks for having me.
No, you're welcome. Have a good evening, Julia.
You too. Take care.
Thank you.